Contraception is a topic that can fire people's passions and often is quite confusing. Fortunately, it's actually a little bit simpler than you may think. Hi, I'm Dr. Joe. Now, contraception means things you do to not get pregnant. Contra against ception, conceiving. Let's keep it fairly simple for this video. There's contraception for males and for females. That's one way of dividing it up. The other way of dividing up contraception is into barrier methods and hormonal methods. Okay, let's look at the males and females first. For males, it is fairly straightforward. There is either a barrier method of condom or, if you like, a barrier method of vasectomy. Now, condoms have been around for about 100 years, and for a period of time, people weren't that fussed or interested in condoms, particularly in the 60s and 70s when the pill was all new and exciting. But I suppose the advent of things like HIV and more awareness of sexually transmitted diseases has brought the condom back. The other thing is technology evolves, and today's condoms, the manufacturing method, are better than they were perhaps 20, 30 years ago. So essentially a condom provides a barrier between the sperm and the egg. It needs to be applied at the time. It's fairly straightforward. Having a vasectomy is a permanent procedure, and obviously that would only be considered by males who don't want to have any more children. It's a small operation. It can generally be done under local anaesthetic. Now, you hear about people having vasectomies reversed, and that can be done, but it's generally recommended, and this is quite important, that if you are thinking about having it reversed, then you shouldn't be thinking about having a vasectomy. Alrighty, what about for women? Again, it subdivides into two categories, barriers and, in this instance, hormonal. Now, the best known form of contraception is, of course, the contraceptive pill. These days we have 25 or 30 different types on the market. They are all fairly similar. The combined contraceptive pills have all got some estrogen and progesterone in them. These pills work by stopping the ovaries releasing an egg. People will say it's tricking the body into thinking that it's pregnant. That's not quite the case, although it is a way of thinking about it. But essentially it stops an egg being released. If an egg isn't released, then of course an egg can't be fertilised and you don't get pregnant. Now, as mentioned before, there are a number of different types. They all are all similar, but different women will find different ones work for them. So don't be concerned about trialling one, giving it a few months, seeing how you go, going back to your doctor and saying, look, this one doesn't agree with me for whatever reason, and trying a different one. The other sort of pill is what's called the mini pill. Now, I don't like the term mini pill because it's not particularly bigger or smaller. It is a progesterone-only pill. Now, we spoke before about the combined pill having estrogen and progesterone. It works in a different way. It stops implantation. So the egg can still get released. It may still be fertilised by sperm, but it can't implant in the uterus. Now, with the mini pill, that's particularly used for women after they've given birth and when they're breastfeeding, and again for some women where estrogen might not agree with them. Now, there are two other forms of hormonal contraception, which are the injection and the implant. These are also progesterone only, so they are similar in some respects in how they work to the mini pill. The advantages of the injection is that it lasts for 3 months, and the implant can last 3 years or more. Again, it doesn't suit everybody. Some women find these forms very agreeable, others prefer not. Another option for women are intrauterine devices. Now again, these were popular in the 60s and 70s and went out of fashion, and there were some problems, particularly in the 70s with one called the Dalkin Shield. Newer versions are much better, and there are forms that release some hormone directly into the uterus, and these are various coils that can be used. So again, generally that will be recommended for women after they've had children rather than before, and it's not suitable for everybody. A bit like with males and a vasectomy, for females, if they've decided they don't want any more children, the tubes can be tied. Again, not a great term, nobody puts a knot in them. It's not like tying your shoelaces, but there is a blockage put, so again, the egg can't get through between the ovary and the uterus. Same with males, it can be reversed, but it's not a procedure that should be done if you are thinking that maybe one day you will have it reversed. So to sum up, contraception, fairly straightforward if you think about it in the terms we've discussed. If you're not wanting to get pregnant, then it is important to use some sort of contraception. People think it won't happen to me, but guess what? It can very easily happen to you. So, Either can be male or female for contraception, and essentially we're looking at some sort of barrier between the egg and the sperm, or some sort of hormonal type of contraception. There are different forms. We are fortunate to have choice. It is about selecting what works best for you.